Download our app available from the App Store and Play Store.
Hello and welcome to Medical Dialogues. I'm Mr. Zaman. Let's look at today's daily bulletin. Through a recent notice, the PG Medical Education Board or PGMEB of National Medical Commission NMC has stated that the matter regarding grant of maternity leave to PG medical students shall be regulated as per respective state government rules. Clarifying on the issue of stipend, the Apex Medical Commission has mentioned that the students pursuing PG medical courses should be paid stipend for extended period of training if it has not been providing during the leave period. Referring to the matter of stipend during maternity leave to PG students, the NMC PG Board mentioned, Postgraduate Medical Education Board or PGMEB is in receipt of a number of references from female PG students, medical colleges, institutes regarding the subject mentioned above. The timing of meals may not have as big an impact on weight as once thought, according to a new study. The study tracked the portion sizes and eating times of 547 people in addition to data on their health and weight over the course of 6 years. The data showed no association between an interval of the day in which people had their meals and their weight, according to the study published Wednesday in the Journal of the American Heart Association. Restricting eating times, as seen in diet trends such as intermittent fasting, has been a popular method to try to lose weight in recent years. But the researchers found no association between restricting eating times and weight loss, said principal investigator of the study, Dr. Wendy Bennett, an associate professor of medicine in the Division of General Internal Medicine at Johns Hopkins School of Medicine. Through a recent order, the Delhi Bench of Customs, Excise and Service Tax Appellate Tribunal (CESTAT) has stated that clinical establishments that provide healthcare services are exempted from paying service tax. The CESTAT bench expressed this opinion while setting aside an order of the Commissioner of Service Tax, Delhi, which had issued show-cause notice to Maharaja Agrasen Hospital Charitable Trust confirming the demand of service tax under business auxiliary service and renting of immovable property service with penalty and interest. However, setting aside the order of the Commissioner, the two-member bench of CESTAT, comprising Justice Dilip Gupta, who is the president, and P.V. Subbarao, technical member, opined that clinical establishments provide healthcare services by engaging consultant doctors, and for the services, an amount is collected from the patients. People with irritable bowel syndrome or IBS have lower bacterial diversity in the intestine than do healthy people, according to a team of Korean investigators. The investigators believe that theirs is the first analysis to find a clear association between IBS and reduced diversity in the microbiota of the gut. The research appears in Microbiology Spectrum. Previous studies of gut bacteria in patients with IBS have been controversial, with inconsistent results due to small sample size and lack of consistent analytical methods used among these studies, said the study author. The investigators combined their own dataset with 9 published shared datasets encompassing 576 IBS patients and 487 healthy controls, analyzing them with a unified data processing and analytical method. Exactly how and why MS and depression are related has remained unclear until a new study by investigators from Brigham and Women's Hospital addressed this gap in understanding. Utilizing a recent study that outlined a depression circuit in the brain, the team attempted to localize MS depression, comparing lesion sites in the brains of MS patients to lesion sites in this previously described circuit and finding new connections and potential therapeutic targets. While many clinicians have assumed that certain lesions were more likely to cause depression in MS, it had never been proven before, and neither had a specific pattern that connected those lesions. Lesion network mapping, or LNW, is fundamental in seeing such a pattern for depression, since LNW allows researchers to envision networks of connectivity rather than just solitary sites of damage. Stroke symptoms that disappear in under an hour, known as a transient ischemic attack or TIA, need emergency assessments to help prevent a full-blown stroke, according to a new American Heart Association scientific statement published in the association's journal Stroke. The statement offers a standardized approach to evaluate people with suspected TIA, with guidance specifically for hospitals in rural areas that may not have access to advanced imaging or an on-site neurologist. TIA symptoms are the same as stroke symptoms, only temporary. They begin suddenly and may have any or all of these characteristics, which I'm going to read below. Symptoms begin strong, then fade. Symptoms typically last less than an hour. Facial droop, weakness on one side of the body, numbness on one side of the body, trouble finding the right words or slurred speech, or dizziness, vision loss, or trouble walking. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.